Good morning, dear friends. My name is Dr. Aniruddha Shetty. I am a consultant psychiatrist and the medical superintendent at Dr. Manaswini Hospital, Arkola, Mangala. Our institute is a new institute which boasts of the most modern amenities in psychiatry, including de-addiction services. At the forefront of our de-addiction services, we have a team who deals with alcohol addiction. As you know, alcohol addiction touches all our lives in one way or another. Addiction is a complex set of behaviors that starts for various reasons but progresses as time goes. It's characterized by various signs and symptoms. We always start drinking alcohol or consuming alcohol with friends or for fun, but it's only after a certain amount of time that a person who's drinking once in a week starts drinking twice a week or thrice a week. A person who's drinking only in the evening starts drinking during the day. And we reach a point where alcohol takes precedence over all other things in a person's life. We then diagnose him or her as having alcohol dependence. Few things what compromises of alcohol dependence is something called as tolerance. If a person was drinking 90 ml of whiskey before, he will not get the same amount or enjoy the effects of 90 ml and would have to resort to drinking higher quantities. This is called as tolerance, and with time a person increases dramatically the amount of alcohol he consumes. Craving is when he stops alcohol or doesn't get it. He has an intense feeling to drink alcohol, which might be, physical symptoms such as increased heartbeat, sweating, or thinking of alcohol. It's called craving. Loss of control. Once he starts drinking, he's not able to control or stop drinking. Continuing despite harmful effects. People might tell him that your alcohol has increased too much, you're behaving not very well after drinking alcohol, but he continues to consume alcohol. Withdrawal. When they stop drinking, they might develop reduced sleep, they might have tremors of their hands, some people may develop confusion, there might be delirious behavior in terms of. All these things may then lead to severe alcohol dependence, which, as you know, alcohol affects every part of your body from the hair to the skin. And alcohol does cause problems in socio-occupational life, which is our social lives, our relationship with friends, family, peer, and occupation. People who drink often miss work, complaints at work. Alcohol also can cause psychiatric illnesses such as increased anxiety, depression, suspiciousness, delusional disorders, psychosis, and puts us at risk of socio-occupational dysfunction. So it's not just relationships at home that are spoiled, but bridges at workplace and society on a whole that's burnt. So what our treatment encompasses of is de-addiction, which includes detoxification, which a person who's consuming alcohol stops alcohol, he might have bodily symptoms, so we give medications to control these symptoms. We give medications, vitamin supplementation to reduce confusion, we give medications to help with sleep. And then once a patient is out of his withdrawal period, we assess for motivation or how much this person wants to change. We do motivation enhancement therapy, which basically includes or helps a person identify how alcohol has caused problems in his life, whether it is personal life, his professional life, or social life, how it's affected his relationship with people. And then we ask them if it would help if he could or she could stop drinking alcohol. We give them a reason to think of how alcohol has caused problems in their life. And of course, we also help them by giving medications that can reduce the craving from alcohol. So even if they were to think of alcohol or were in a situation where alcohol is referred to them, that want to drink would come down with certain medications. There are certain other medications as well, which is called as aversive medications, which are, once they're on that, if they consume alcohol, they can have unpleasant reactions. So people often say or take these medicines to prevent them from continuing alcohol. So it's a holistic approach towards addiction that we provide at Dr. Thunga Manaswini. And our aim is to help them abstain from alcohol, and regular follow-up, motivation enhancement with medications go a long way in helping a person and along with family support in pulling him out of alcohol dependence. Thank you.